estimates for people's, this is probably one of the last times we're gonna see them, they're getting their last vaccines if they haven't already had them. And we do require 2 fecals as a puppy.
2 negatives.
2 negatives, yep, 2 negative fecals as a puppy, so you have to take the time to go back and be like, are there 2? When was the first one, was it positive, and we treated, did we do a second one after that, and then kinda like do the math and how many poops do we need, so if they come back and we just treated for a positive in October, well, we're good for 2 more fecals, so I can put on their fecalizer send, cause I need to remember to mention it to them. Hey, we're due for a second fecal, we just treated you for roundworms, we haven't had any, you know, we can split it up, but like, they need to know that they need 2 negatives, and then it's once a year, you know, annual, or 2 negatives after any positive. Okay, cause then they can take home 2 fecalizers, and I'd be like, okay, bring one back in January, bring one back in February. If they're both negative, you're good till next year.
And they should have already heard that at one of their first puppy or kitten visits anyway, because the assistants should be talking about that.
Does that go for rabbits?
No, just one.
Just one?
And cats are
'Cause there's not
typically
really
at
any-
least one
They only
because they
get
use a
custody,
litter box.
basically. And they don't get a lot of exposure.
And dogs who stay here in the building, if they're here for the day, technically, a fecal is required because they share our yard. So if the owner fusses about it, to say, you know, we try to keep our yard clean because you don't wanna pick up roundworms from our yard for your dog going out there, so it's.
And I'm sure everyone knows why we need 2 negative fecals. So you can answer
Yes.
that question.
Life cycle.
I guess it is your birthday if you want to answer that.
That's
There might be a prize involved.
Oh, I,
Dana did say because of the life cycle of the parasite,
Yep.
they're not always detectable.
That's correct. So you can have false negatives because they only shed their eggs every 2 to 3 weeks. You get yourself a prize out of the couch drawer, or whatever you call it, kudos couch. Couch drawer. So Sam, we have a kudos couch that if you do something a little extra special, the doctors, the managers can, let you get in the couch. Kudos couch, not couch drawer. So any questions about these? Everyone's comfortable with those? I know most of you guys have been doing these anyway. But you know, even the receptionist, it might be a nice refresher for you guys, because I know you have to go over so many estimates over the phone, unfortunately, I'm sure. And that can help you kind of streamline it for clients as well. Did you have a question? You just point with your hair. Okay. So the ones that get a little more complicated, we'll just use like a mass removal as an example. So it's, the assistant's gonna have a hard time doing that, because you have to go to the doctor and ask, how long is it gonna take you to remove this? And it depends on the doctor and how long they've been in practice, and so my rule of thumb is always overestimate. We'll use an erythematoma as an example. An erythematoma takes me, and I've been doing this for 30 years, at a minimum 30 minutes of surgery time. Because by the time you put all those sutures in the ear, there should never, ever, ever be an erythematoma that has less than 30 minutes of surgery time. I tend to put 30 minutes to 45 minutes because it takes forever. It's just a very slow process putting all those sutures in the ear. So just as a, note, so like for example, I don't know where the tumor removal one is.
This is it.
Oh, this is it,
Yep.
okay. Oh, God, I hate the fact that, okay, so is this some group code that doesn't
it's
pertain?
mass one, I think.
Okay.
Mass what? Whoops. All
right. So I have to be honest with you, I'm not a big fan of the group codes because things get missed, and what happens is a lot of times they download the estimate to invoice and it's all wrong. And we'll use this as an example of why it's wrong. So it says 1 to 4 minutes of surgery time. So do the math, that's up to an hour. Anesthetic time should always be a minimum of 15 minutes more of whatever your surgery time is, because that's 15 minutes to prep the animal. So whatever your surgery time is going to be, which is, you have to ask the doctor, you're not going to know, 15 minutes, once you know how much, like I said, okay, that's going to take me 45 minutes, or I'll give you a range to take me 30 minutes to 45 minutes, you should be able to do everything else yourself. I don't charge nursing care, I'll be honest with you, not for surgeries.
Me and Lori do.
For surgeries?
No, for this, yes, for cystotomy, or your.
You know? Okay.
Okay, wait a minute. So
I try once in a blue moon. I charge nursing care for hospitalized cases.
so surgery should be 30 to 45 minutes, right? Is what you're saying? The
Depending
surgical
on-
time.
Yeah, depending
be-
on what you're looking at. I
Right.
mean, that's, to me, we should be able to narrow
Oh, that was for
down.
the hematoma. I'm
So,
sorry. Okay.
Yeah, so this one, the reason why I don't like this group code, like, we should
I
be
can
able to,
fix it.
Okay, well, once again, once again, I think a group code is very hard for a mass removal because it's gonna be so individualized. Like, we use drains about once a year.
Right. So then you have to take that off.
Once again, I don't I have a hard time charging nursing care for surgery because surgeries are so expensive. I know we should be charging for hospitalized cases. I'm trying to be better about it.
So do you want us to charge hospitalization and nursing care, or just hospitalization?
Hospitalization is what you
For
should
sure,
be charged, yes.
but not
For
both?
surgeries. So for surgeries, they should always be charged a hospitalization
Right.
based on their weight. But I think we should take off
Just
nursing
take
care.
Nursing care?
I
Okay.
think
But then
it's too much.
can we vote to charge nursing care on hospitalized cases when we have them?
Yes.
Because they need medicated and treated and all
Yes.
of it.
I mean, if we're tube feeding them, I always charge. Parvo's always, things that take up a lot of your time. I try to. But we should be
And I
charging
can
nursing
make-
But
care.
we're just trying to be consistent
I
for
can-
everyone for the estimates.
I can make that drain placement say 0 to 1.
We don't use them once a year.
We hardly ever use them.
Once a year we use
Okay.
them.
But
Once
then
every
when we
4
use
times.
them, are we gonna remember to put it on?
That's why I don't like group codes.
Well,
You're-
that's why it's already on there and you just take it off.
Because clients don't look at that, Shannon. They look at the bottom dollar.
Sure.
But they're not gonna see it.
I
if
mean,
we
when I
take it
say
off.
once a year, I have used a drain once in the last probably 8 years, literally, because you don't need them anymore.
But that's like cutting the red rubber.
Anyway, take it off. Let's move on. All right. So the surgical pack and supplies always, as I'm sure you guys know, and I would like you guys to do these enough that you're familiar with the codes. I mean, I know that takes time. IV catheters are always separate when it comes to non-elective surgeries. So non-elective is tumor removals, cystotomies, pyometras, anything other than spaying or dental, basically.
Is there a time that we would use, I know we don't do orthopedics much anymore for
Mhm.
us, but there is a code in there when you do surgical pack and supplies. It's the bone pack and supplies, in case occasionally I'll click on that thing
By
by,
accident.
or whatever by accident. And it's a little bit more expensive, but would there be a case that you three would do something that we would need that?
No.
Okay.
It's always going to be SS1. It's S1155.
Right, but I didn't know if there would be any reason we would need that bone pack.
No, we can
code
delete
anymore
that
then.
code.
Okay.
Yeah.
Gas removals are not elective,
They are not elected. That is correct.
so there should be an IV catheter placement on
That is
that
correct.
cell phone.
You got it. And that's the FLSX is the code. And, is it grooming? I assume grooming. E-collars for pretty much everything. The miscellaneous is just a fudge factor in case we forgot something. Pain medication pretty much always. Now, to me, that pain medication should include the Rimadyl injection and the go home, so that should actually be closer to $50.
Yeah, I have
Yeah.
noticed with the 50 to
Yeah.
75.
Do you always give Rimadyl?
Yeah,
Yeah.
pretty much. And that's the problem too, is once again, this is the problem with these group codes. I hate group codes, guys. I'm just gonna be honest
But I
with
can
you.
fix it.
No,
That's
you
the thing.
can't. I'll tell you why you can't.
Why?
Are you gonna do one for every 5-pound weight difference? Because that's what it's gonna be. Think about your Rimadyl. It's gonna be different for a 5-pound dog than it's be for a 100-pound dog.
But if it's like this, whoever's doing the estimate, whoever's making the estimate, it should review and say, oh, it's only to 25 pounds. I have a 75-pound dog, so you switch it out.
I'm telling you, it's gonna be a waste of everyone's time.
I would forget. That's my
I would
thing.
forget,
I,
exactly.
if I don't have a list to go by, I'm gonna
The
forget
problem
it.
is, they're just printing these off and we're giving them to clients.
That's the problem right there, exactly.
I know. but
That's the problem.
It's gonna happen.
People need to review.
The reason we got rid of the group codes is because there were
What's it
3
going up for?
surgeries in a row that were so underestimated. I literally lost probably about $3,000 that day. No joke. So this is why I get frustrated with group codes, but I'll leave it up to you guys. I have the codes memorized, so I don't need a group code. It's just easier to type it all in, and I get it done. But the whole idea, once again, we really need to get away from the doctors doing this. So if you really want to do group codes for mass removals, you're going to have weight ranges, probably 10-pound increments, from 2 pounds up to 125 pounds or something.
How do I have Rimadyl injectable in the computer though? I don't have it by the weight.
So
No,
what happens?
But that's why so like when we're doing things, that's why there's always that 25 to 75 range to, but then if you get a 100-pound dog, it's more than that. But, I mean, there's gonna be, so the most important thing for assistance, if you're saying, hey, get an estimate for a mass removal, you then ask the doctor, how long do you think it's gonna take you? We give you an increment of time, and then you should be able to do everything else, whether you're gonna use a group code or not.
And it's just extra 15 minutes of anesthesia time on top of the surgery.
Correct. Yeah. And in general, what I always think of is, okay, I think like chronological order, so I think, okay, they come in, I always do fluids first, because that's what I think what the technician's doing. Hospitalization, anesthetic, surgical pack, surgical time, pain medication, e-collar. So I kind of think of just the way my brain works. And like cystotomies, all of those other surgeries, it's all about surgery time. So for example, and Dr. Mitchell can attest to this because she's had to do a few, when you have one great big stone and a girl dog, it's quick. It'll take you a half an hour. But if you have a boy dog with thousands of little stones, it's gonna take you an hour to an hour and a half. And you guys aren't gonna know that, that's why you have to go to the doctor and say, and Dr. Mitchell and Dr. Pat may not know that because they're still fairly new, but they can give a guess for example. And they might not even be the one doing the surgery, which is the other problem, is you don't know if they're gonna schedule on Dr. Mitchell's day versus my day versus Dr. Kat's day. So a lot of the times you'll notice when I am recommending a surgery, I make them schedule right then and there so I know it's with me. Because one thing I can tell you that is difficult on veterinarians is, especially for me, I hate doing surgeries on patients where I don't know the client. And the reason for that is, when is a patient most likely to die unexpectedly? During surgery. Yeah. And so if I've never met that client, they don't know me, that's a much more significant liability situation than if I know the client. If those clients know me, because I obviously bond with these clients, then if God forbid if something dies, say, hey, at least they know me well enough to know that I did everything I could, they know there's no liability there, and it's gonna be okay. Now, so I try really hard to do surgeries on my own patients, and I try really hard not to dump them on these guys. If I do dump them on these guys, I know they're clients that aren't gonna do anything stupid, basically. So most of the time, I try to get them scheduled as soon as I can. That way, they're done, it's on the books, the receptionists don't have to worry about it. I know every once, for a mastectomy, we might need 2 surgery slots, and the receptionists aren't gonna know that, neither do you guys, so that's why I kinda try to, that way you can manage your own surgery schedule, which I certainly prefer to do, and I'm sure you guys will too. Does that all make sense? Yes?
So this says mass 1, it just kind of indicates that's for one mass removal, and says histopath 1 site. If we're doing multiples, if we're doing extra, like 2 or 3, got a couple lumpy bumps and we're taking them all off, those will get submitted typically to Antech as 2 different sites. So there's an additional histopath to Antech. It's less than the first one, but there is still a fair amount of charge.
Oops, that's wrong.
Go to items.
Sorry, yep, I saw that.
And histopath is not optional. Very, very rarely is it not optional. I might say if I pull something out and I've cut it up, but I think it's a lipoma, or eyelid masses I don't always send off because they're always benign. But
There's additional sites.
99.9% of the time,
Why do they have
histopath is
so
not
many?
a choice. They have to
Oh,
do it.
second
Because
and
we've
third.
got clean margins,
For all masses, if we're removing more than one?
typically. Now, every once in a while, like a papilloma, I don't send those off. But generally, if a client says, well, I don't want to do histopath, when we're going over the estimate, be comfortable explaining to them why it's so important.
Right.
And it's important, especially if we haven't FNA'd it. We have no idea what the hell it is. I need to know if it's cancer versus benign. I need to know if it was cancer, that I get clean margins, and that's going to totally determine my next step of treatment,
Right.
and also the prognosis of the patient. So histopath is really important. I'd rather give up blood work than histopath if I had to choose.
Kind of the same thought
Even
process
though-
on 2 sites
It's just
surgically
different
being
cancers.
removed, that's an additional if we FNA too. That was left off on somebody I did. I FNA'd 2 sites and we only quoted for 1.
On
so-
big,
Oh.
on those additional sites.
Yeah, so there is an additional site.
And I think
for
there's a
FNAs
discount
too.
if you do additional.
Yeah, there is. We allow
And it
that.
was
That's
kind of too late that they paid you, it wasn't until the
Oh,
next day they got sent out.
Perfect.
So you do have to charge for the first one,
What I would be inclined, my
and the
suggestion,
second one,
when it comes to group codes, I would be inclined to have a list of the codes. Because they might not have them memorized, so they can know, okay, S1155, FLSX, anesthesia 1. If they could have a list of the codes that come up, but then they have to put in the amounts. I think would be the easiest thing. Because 2 things, and you guys know, I feel guilty how expensive veterinary medicine's become because I'm old and I remember when surgeries used to cost less than $200. And obviously I'm running a business, so I have to charge accordingly. And our prices are very fair. They are actually very fair. We're a little lower than average, to be honest. But I always have this guilt with these big estimates. I really struggle with it. And that's why I'm always trying to find ways to make it be as you know, as less expensive as we can for owners, because I do worry about the nature of veterinary medicine. And I think over time it'll get too expensive for people to have pets, and I don't wanna see that happen, so, but still trying to run a business obviously as well. And still practicing high quality medicine, which we do here, you know. Any questions about that?
On the histopath, as you can see, you always have to charge for the first one. And then like if you have 4, you'll charge the first one and then the one that says second, third, and fourth.
Oh.
Yeah. So you always have to do the first one.
And then second and third.
Yeah.
Luckily, it's not that many times we're moving that many passes, thank God.
And
Once in a while.
we would depend on the HIDOTs, we would depend on you guys if you're thinking it's a mass cell and we'll need
Benadryl.
Benadryl and Pepsid. We wouldn't, nobody's ever gonna automatically think to ask that.
Hopefully the fudge factor carries.
So
towards that.
when you say, oh, I need 30 minutes of surgery time, well, I'm gonna give you 30 to 45, but that's your cue to tell me, I think it might be mast cell, I need these injections, please, thank you.
And these guys probably know enough now that, you know, surgery's unpredictable. Like, you think it's gonna be quick and sometimes it's not. And so that's why I tend to have a range, and clients are always thrilled when it's less than they think it's
Yeah.
gonna be,
The very
you know,
top one.
obviously.
Is that the first?
That's the
second,
first
and
site.
third?
But
Yep.
I
And then
I
the bottom
tend to,
one.
I mean, I've been at
If
this
you
so
have
long, I
4.
know how long pretty much anything's gonna take me, but especially with the newer docs, they may say it's gonna be a half an hour to an hour and a half, cause they may not know, you know. Like a toe amp, for me, takes 15 minutes, but when you're doing your first one, it might take an hour, you know.
I have a question, for one of the estimates that were handed out.
Yeah.
For the station drop off, I have never quoted that much before. It goes all the way up to 954, 96. And
Yeah,
then
usually you
it's,
say 500 to 600.
Yeah.
Yeah.
I never have seen one go that high before. I'm just trying to figure out where the hell this went wrong.
We've got
Oh,
like
yours?
nursing
Yeah,
homes.
this is not correct.
Okay,
There's
so
3
what else
extras
is on
in
there?
there first,
Yeah.
usually just do 1 and 2.
Yep. So, first of all, injection in hospital, I would get rid of that.
Okay.
Amy knows exactly what I'm gonna do from the minute they walk in the door till they leave. In fact, why don't we do this? Will you make one?
Yeah.
Okay.
She knows what to do.
It will help promote poops. Can you do it for this?
But I mean, actually, if you guys aren't, because I would like all the assistants to be able to do the rabbit GI stasis estimates. Basically, I can look at that again, just make, because like,
If you
Amy will
get,
fine tune it, but there's,
if you give it to me, Amy, then I can fix the package.
You got it.
so Cisapride, that is the oral drug to help, it's a GI motility drug, it helps push everything through. Meloxicam pain medication, metoclopramide is an injectable drug to help push things through the GI tract. As you guys know, I would always do blood work first, X-ray second. I prefer to do both, but if I had to choose, I always do blood work first, because you get more information from blood work than you do from a radiograph. I do like to do Cerenia in everyone, and I always do laser in everyone. And then there's usually a tech consultation to teach them how to do fluid therapy. There's like at-home fluids and all of this stuff. Now midazolam, I guess we could put it on there 0.2, because sometimes I need it. Sometimes
Just
we don't.
bedazzled or
Ampri is on there.
Just midazolam. It's fine, it'll be cheaper. And even the exam fee is, once again, that's with these group codes. How do you know which exam fee it's going to be? Because you don't know if they're coming on the weekend, if they're coming during the week. So you have to have a different one for weekends versus, that's the only thing that worries me about these group codes is you just end up giving it to the client and it may not be right at all.
Well, and I can certainly put, like the asterisks that we have, asterisk exam. You need to figure out what exam you're giving.
I will promise you it will be handled like that. We've done this before. That's why I stopped with group codes. But
We've never
maybe
had
this
a
crowd
bad
is
meeting
different.
about it, and